And we're watching those rates go up again, and we have another new variant to contend with.
I'm not surprised. When we started seeing our first cases of COVID, we all discussed how quickly will this virus mutate. And when you think about the US population or the worldwide population, never ever having seen this virus beforehand, everyone's getting infected. The more people that get infected, the more variants we're going to see. So it's not surprising we see new variants breaking out all the time. What we have to think about, though, is how are we going to get ahead of the game? Is it going to be a combination of vaccines and masking? Is it going to be a combination of vaccines, masking, and getting infections? And the answer is it's probably the last. It's going to be some vaccination prevention, some prior disease prevention, and masking to prevent you passing it to the next person.
Now, we know there are locations in the tri-state that do that test to treat. You can test right there, and they'll be able to give you Paxlovid. But we are hearing so much about this Paxlovid resistance, including with Dr. Fauci.
Right, so there's a question, was it resistance or relapse? And they're actually a bit different. Resistance means that antiviral won't work. And that's not what's happening. It's actually relapse, in that we think the virus was still there. We didn't treat all of it, and the levels of the medication kind of turned down a little too low, and it allowed that virus, that same strain of virus, to come back. So they've actually looked across the country at those people who had Paxlovid and how many of them were sick enough to come back into the hospital. And interestingly enough, the number was 1%. So we're seeing some relapses of those infections, but only 1% of them are sick enough to come to medical care. So if you've had COVID and you felt better after your Paxlovid and then you felt sick again, that's not so surprising. It may be the drug levels were a little too low for you in particular, but it's not enough virus to bring you into medical care. And that means you're still safe at home.
Now, if people are deciding whether or not to boost, or the timing of that booster, looking to the fall when maybe we're going to be indoors more, in close quarters, how do you decide the timing, if you are going to boost?
So I think there's no one right answer. I think some of the questions are, who are you? How sick are you likely to be if you get your COVID? And what are your plans for the fall? Are you planning a big event? Well, if you're planning a big event with a couple of hundred people, like a wedding or something like that, I probably want you boosted at least 2 weeks before the event. On the other hand, I, as many other infectious disease doctors, are quite concerned about the fall and winter. We expect that not only COVID will be hitting us in the late fall and winter, but other viruses as well. And we think that the COVID booster lasts at least 3 months. So by timing, we'd really want you to get your booster in the early fall, because then you will be protected for that late fall and winter time.
So do we wait for that bivalent, that combo of the original and the Omicron specific booster to come out?
I'd love to have that one available for everyone as soon as possible. But again, if you're planning a summer wedding, I kind of want you boosted now to make sure that you're safe at the wedding and so is everyone else. But if you're not planning a big event, it would be great for you to get that booster early in the fall or as soon as it's available to protect you for the rest of the fall and the winter.
Now, what about these nasal spray vaccines? We know there are 3 that are in those phase 3 randomized trials, and you would think, like, if that's how this is spread, that would be a great way to get the vaccine instead of in your arm.
It would be absolutely the way to go. If we could prevent your initial infection, meaning your nose and throat, by using a live vaccine or a vaccine that you go into your nose, that would be so much better. But we need to see the data on how well those vaccines are preventing COVID. The bigger question is, are the vaccines we're using now the right answer? Or is there a better vaccine that we have to develop that goes across all coronaviruses and not just COVID-19 or this Omicron strain or the next Omicron? There are a lot of people working on those. And that's where we have to be in the future. If we have a trans-COVID vaccine, meaning it covers all COVID variants, that's the one we want to get.
And we're
just
just
not there yet.
Yeah, we got word, just in yesterday from Pfizer and BioNTech that they're starting to test this universal vaccine for all the coronavirus, and they're starting that on humans.
And that would be great, because that's going to be the right answer. And we won't have to worry about the variants. Right now, every time we see a new variant spring up, The danger is that virus going to be more deadly than the current one circulating now? Each time we've had a new variant, as you've noticed, they've been more infectious because viruses like to spread from person to person. The good news is the Omicron is not as deadly as Delta was or the original strain was, but that's just by chance at this point. So having a vaccine against all coronaviruses would be 100% where we need to be.